The United States has officially severed its ties with the World Health Organization, marking a historic and total divorce from the global health body that has defined international medical policy for decades. The Department of Health and Human Services confirmed this week that the withdrawal is complete, finalizing a cornerstone of President Donald Trump's America First agenda. This move isn't just a symbolic gesture. It is a seismic shift in how the United States will handle everything from pandemic prevention to the development of your annual flu shot. On day one of his second term, the president issued the executive order that set this machine in motion, and today, the funding has stopped, the personnel have been recalled, and the American seats at the WHO table sit empty. But while the administration calls this a promise kept, the legal and medical fallout is only just beginning. Legal experts point out that by law, the U.S. was required to give a one-year notice and settle all outstanding debts, including an estimated $260 million in unpaid fees. However, inside the administration, the stance is clear. Why pay into a system that they believe failed the American people when it mattered most? Senior officials argue that the United States was the largest financial contributor, yet received the lowest return on its investment. They point to a stark reality. In the history of the WHO, there has never been an American director general, leading to a sense that the U.S. was essentially subsidizing an organization that did not prioritize American interests. The core of the administration's grievance stems from the COVID-19 pandemic, where HHS claims the WHO delayed declaring a global emergency and instead echoed praise for China's response, despite early evidence of information suppression. This withdrawal is a direct response to what the White House calls unaccountable foreign bureaucrats exerting control over domestic health policies. For the average American, this means a total overhaul of our national health security strategy. The administration isn't planning to leave a vacuum. Instead, they are shifting the lead to the U.S. Centers for Disease Control and Prevention and its Global Health Center. The strategy is moving away from a centralized global authority and towards a patchwork of bilateral agreements with individual countries and non-governmental organizations. The administration insists that America will remain a global health leader, but on its own terms, working directly with ministries of health around the world rather than through a middleman in Geneva. However, this transition has sparked a firestorm of criticism within the American medical community. Public health experts warn that infectious diseases do not respect international borders, and that global cooperation is a biological necessity, not a luxury. Critics argue that by walking away, the U.S. loses rapid access to critical epidemiological data, virus samples, and the genomic sequencing needed to create the next generation of vaccines. Some are calling it the most ruinous presidential decision in a lifetime, fearing that when the next pandemic hits, the United States will be blinded to threats before they reach our shores. They argue that without a seat at the table, we cannot lead the global response, leaving American citizens vulnerable to outbreaks that start thousands of miles away. Even the WHO leadership has called this a lose-lose proposition, suggesting that both the organization and the United States will suffer from this fractured relationship. As the administration prepares a series of new health announcements in the coming months, the nation stands at a crossroads between national sovereignty and global integration. This is more than a policy change. It is a fundamental bet that America can protect its own borders better than a global collective can. Whether this leads to a more agile, America-centric defense or a dangerous gap in our early warning systems is the multi-billion-dollar question that will define the next decade of American health.